I do have a long healthcare background. Not only have I been 20 years in the US healthcare system, before that I was 15 years in the Australian healthcare system, before that in the UK healthcare system. My whole career has been in innovation and technology in that space. What I'd like to do today is try and pull some threads together around these two separate terms we've used in this conference. We've talked a lot about precision medicine, and we've talked a lot about longevity. And I'd like to suggest as we get into this that we've had a lot of content, and I think we're going to get more before the day ends, but I think there are some wider contextual issues, which is why I've called this particular talk Innovations and Challenges, as it relates to this particular space. So again, we'll see what the clicker's like in terms of moving on. Like so many speakers before, 3 or 4 have started with demographics, and I'd just like to emphasize, I've taken a little bit of a different spin on this, because this is a worldwide challenge. The charts you see on this chart in black are the countries that are facing a current crisis. In fact, the lighter they get, the easier it gets, but we all face this as a global challenge. This is the most enormous challenge perhaps the planet has ever faced, in terms of not only the sheer volume of people, which is the size of the bubbles you see on the chart, but also in terms of living longer, of course, which is what this whole conference has been about, and how do we do that. China, for example, stands very much as the standout on that particular chart, but many countries, the UK, Japan and others are there as well, and have got these are the current crises. The ones in dark blue, the US being one of them, of course, has got this challenge very much in its near future, in the next 10 years or so, as we'll see in a second. We just, so as not to miss out the Canadian chart, again we saw some figures on this earlier on, one of the reasons it's not black on the chart, or even dark blue on the chart, is because immigration in Canada has balanced that. It doesn't mean the problem's gone away, it just defers the issue in terms of how many people you've got on a balanced basis in terms of that chart. But you can see you fatten the middle of that chart considerably, so Canada also faces the same challenges in terms of longevity in the future, a lot more people living in society. And finally, just to get to the US, so as not to forget it, I'm not going to go too far ahead here. There we go. I guess what I'd like to emphasize on that particular chart around the US is we're almost doubling the numbers of older adults of 65 plus in the space of 44 years. That is incredible. We're going from 49 million to 94 million people in that short space of time. Just think about that. Think about that in terms of the Canadian population today. We're adding essentially more than the Canadian population in a very short period of time. I heard this once described as an elephant walking across the room. It's inevitable this is going to happen. This isn't science fiction, this isn't made up, this is the future, and we need to prepare for it. So back to what I said about contextual comments, we've got to think about what it means for society as a whole. So let's talk a little bit about precision medicine. I don't need to go through too much of this because so many talks before have defined what we're doing. It has many aspects to it. I think the promise of precision medicine in particular is wonderful. It's wonderful for healthy longevity and health span, as we've talked about. And I'm going to go past that just because so many of people have defined it rather better than I. But what I'd like to do is just emphasize, I hope that doesn't go off, that there are two aspects for it, and one I'm not going to spend the rest of this conversation spending much time on, but we talked about the pursuit of health span, particularly as it relates to these 12 areas that were talked about earlier. I think have all got individual conferences that you can have on every single one of these. We need to take that seriously and have a lot more conversations like the ones we're having in this room. What I prefer to look at is something that those of you know, Phil Newman is a researcher out of the UK who puts together, that's what I believe you see over here, these 10 levels of action that we can take as it relates to health span and longevity. And I think these are interesting because it starts at the top with the things that are all within our control, and ends on things that perhaps are more in the realm of science fiction. So right at the top, we talk about lifetime management. We've had a lot of conversation, including the last panel on that. Consumer diagnostics, taking supplements, and even longevity clinical services, which are starting to arise at scale now. But in the middle, as soon as you get to number 5 and beyond, we start to see less and less activity, but you will see more in these areas, all the way down to the last 2. So organ and organism preservation is going to be a huge issue. We know some people who've got the wherewithal fiscally to do this, are already starting to do this, preserving organs. And of course the last of them, which is actually corporeal or consciousness preservation. So the whole science fiction idea that we can actually save our personality, our brain, wake it up again in 100 years' time, and it's preserved through all time. And in fact, a lot of the conversation around AI comes into play, which I know my colleague Daryl's going to be talking about a little bit in terms of where AI is taking us. But it's quite a nice way of breaking up this topic so that as we talk about it, we frame it, we give it, we actually start talking about what it is we're referring to when we talk about either precision medicine or indeed we talk about longevity or health span as a subject area. Let's just define our terms in terms of what we mean by health span. Again, I think this has been done well by previous speakers. Normal aging today and health span looks something like this on this chart, where, perhaps certainly in the US context, we've got a lot of chronic diseases. We heard earlier it's 1 in 4 adults are now suffering it in the entire population, 1 in 2 adults in terms of the older adult population. What we want to do, our goal, move, there you go, is to try and we start doing more of in order to go and increase health span. So not only do we increase lifespan, we actually live longer, but actually we do go as near as we can to when we pass in a healthy manner. That's what we're talking about, just to define our terms. So let's talk a little bit about precision medicine and the promise of all of that. And the way I'd like to frame that is I think we're on a journey to a better future, but we're not there yet. And it's not just about what we can do in terms of drug dosage or titrations, for example, which a lot of people talk about as if it's the whole show. And it's far from it. It's one of the promises of many, as we'll see. So when I say we're on a journey, where have we come from? Now, I could have put a lot on this chart, and I decided not to put too much. Where has medicine come from? Really in a very short space of time, in less than 200 years. So the first era of medicine, if you go past, present, and future, was we had lots of public health diseases, and we had child mortality at very high levels early on, for example. We had high deaths by violence and war. We had long, painful, chronic suffering. And that was just on the longevity side. On the precision medicine side, we were really in the realm of guesses and experiments. Let's fast forward that to the present. And again, I could have put a lot more on this chart, but on both sides, we had a focus on lifespan, with all of the subsets you can see, particularly eliminating infectious diseases. We've done an incredible job of that in recent years. Managing those chronic conditions, minimally invasive surgeries come about, and it's now routine. And now we're starting to focus on vulnerable populations, although I would say we do have, as others have said before me, a sick care system. So I heard this as a quote once: we drug, we cut, we puncture, we burn, we poison, and for those physiotherapists in the room, we sometimes touch. But those have been our prime mechanisms in the last 20 years or so. So clearly we need to move beyond that. So where are we going? We're going into this next phase. And this next phase is the most exciting of all, but we have to be ready for it. We have to think about the infrastructure that will support the new emphasis on both sides of this equation. So it is a focus on health span, we've heard all of that. So we're really starting to use data and clean data, as I'm sure will be said subsequently, and missing data, just as importantly, to drive health span. And I think that's about not only using genomics and genetics and all that capacity to even change genetics through CRISPR and other technologies, but also encompassing social determinants of health, which we haven't talked about much directly, but I'm going to talk about it more as I go. And on the precision medicine side of things, I think we've got just as much exciting change coming along, particularly as it relates to biomarkers and polygenic risk scores. And I think relating those in interesting ways is going to be turbocharged in the next even 5 years, I would say. One thing, again, in framing terms I'd like to do, and a couple of things I'd just like to suggest in terms of our language and our terminology. One of the things I'm very fond of, and I didn't invent the term, is stage versus age. I think one of the things we do is we're sometimes lazy or sloppy with our language, and age is a corollary with how we feel about someone. You're in your 60s, therefore you must behave this way. There are people in this room that who are in their 60s who feel like they're 40, and some who are in their 60s who feel like they're 80. So stage is a much more descriptive way of thinking about than age. So I think that's something we can start changing in our framing. I think we also know we've got to move away from the things on the left, and I think we've got to de-emphasize, as again others have said before me, in terms of illness and sickness. And I think illness and sickness continues to need care assessments, care itself, and coordination. But I think the right-hand side is what excites me the most when I talk about innovation. So wellness and thriving, which I think is about prediction using the data that we're gathering. It's about planning, and it's about prevention. So we go from 3 C's to 3 P's in terms of where I think we're going in the future. It doesn't go too much further. We've talked a lot about this, so I don't want to go too much over it. This is the first tier of any longevity science. Has got to be the things that are within our control to do as human beings, and that's obviously some of the lifestyle changes that we can make. That's not easy. I'm a psychologist by background. We've had a few of those recently. That was my PhD. I like this area a lot because I think we have the potential to be the captain of our own health ship, and I think that's where it starts. So all those 10 things on the left you've heard from others, I think are things we can all do in this room right now without waiting for the promise of some of the things that technology will help us deliver. But even technology delivers some of that as well. We talk about, for example, I'm wearing an Oura ring, for example, because I sleep badly, and it's given me data to help me change that pattern. But I have to be the one to go and make the changes. No one else is going to do that for me. Let's see if that moves. It does. I want to talk just briefly about AI, and I'm not going to spend much time on this, but to say, obviously, it's going to have a massive impact on us, and I think the particular ways are going to be not only everything on that chart, but everything you see here as well. So I think we're going to go and have massive data sets that we're going to have to wrangle to go and get the best from them. And I think it's going to come from not only all the IoT devices and the wearables, but many other places as yet unknown. I'm going to go through this quickly just to build all the rest of them, if it will do it. I think it's going to come from lots of diagnostic images. It's going to come from personalised treatment plans. It's going to come from our potential to do drug discovery on a very different basis. And it's going to be coming from continuing to be able to monitor health metrics and then loop that back to go and personalise the whole experience. So I think AI has obviously got a very large part to play. Ultimately, analysing those data sets, creating biomarkers to help not only the individual, but future individuals, generations, and wider populations. I wanted to be specific, and I'm happy to make these slides available to anyone in the room who wants them, because there's quite a lot of detail in here, so I'm going to read the headline at the top, not the detail underneath it, just to save some time. I think there are 6 areas in terms of likely impact for innovation. For me. The first of those, I think, is in diagnostic and risk assessment. I think this is going to be transformational in the next 10 years. In all those 3 areas, early disease detection, accurate diagnosis, and personalised risk medicine. I think it's also going to move in treatment and management, so targeted therapies, precision drug prescribing, and minimally invasive interventions. We're going to see a lot more of that coming. And I think it's going to come in disease prevention and wellness. In proactive lifestyle modification, precision nutrition, love the presentations we've seen today already on microbiome, and then early intervention programs that happen much earlier in life or at a much earlier stage in life than perhaps we're all used to. And I think we'll create guidance and education around those things. The fourth area, I think, is going to be healthcare delivery and technology. I think we have to almost upend our legacy healthcare system in order to be able to deliver this. The legacy system will not deliver this in the way it's currently set up, and certainly not in the way it's financed. So that's data-driven decision